Good evening to all of you. Thank you for coming to this very special town hall meeting. It's very special because this is the first town hall meeting in our 13 years that we've had the director of the Office of National Drug Control Policy to be a featured speaker. So, isn't that great? That's wonderful. That's wonderful. So really good evening to you. Those of you out there, please come on in. There are plenty of seats over on this side. Those of you on the back row, since I grew up in the Baptist church in the South, this is not a Baptist church because the Baptist church always fills up from the back pew to the front. Everybody comes in church and sits down in the back, and then the last ones have to be forced to go up to the front. So it's okay to come up front. It's okay to come up. So good evening to you. We're excited that you're here, and it's wonderful to see so many of you in this town hall meeting this afternoon. I am really, really pleased. As you know, I'm going to give you just a little short history, and then I'm going to do what I was asked to do and make some introduction. But a little short history that many of you probably are aware, at least some of you are, that back in the mid-90s, CADCA was fortunate enough, under the leadership of Sue Thaw, to carry the drug-free community concept to our friends at ONDCP and into our good friends in Congress. The legislation was passed in, I think, the spring of 1998. It became law. I first met CADCA in the spring of '98 in Atlanta, Georgia, where the President of the United States and his entire cabinet was there to announce two programs. It was the media campaign and the drug-free communities program. It's when I first met Sue and I first met CADCA. I then became a part of CADCA later that summer, and during the reauthorization in 2001, the program some 5 years later, CADCA was attempting to provide all of the TA, the training, the evaluation, and research using private dollars, because all of you know CADCA is a private association, and we were having a hard time finding the necessary dollars to build the infrastructure that was necessary to train and enhance the growth of the ever-increasing number of federal grants. And we asked through the administration to Congress to add the National Community Anti-Drug Coalition Institute. We only call it the Institute. And sure enough, the President of the United States came to our National Leadership Conference in 2001, sat on the stage in Washington, signed that reauthorization, and in it was the Institute. We then, CADCA had already applied, so we had to go through a competitive process to become the official leaders of the Institute. We passed that test, and we've been managing the Institute at CADCA since that time. So I wanted you to know that little bit of history because we believe it's a wonderful public-private partnership where we, the private part of the partnership, working with our good friends at the Office of National Drug Control Policy, that I'll talk a little bit more about, and our good friends over at SAMHSA, the Substance Abuse and Mental Health Services Association, joined together to build this private partnership. And the Institute then was charged with three basic things. I won't go through all of them, but the primary thing I want you to understand is that we were charged with providing the training and the technical assistance, the evaluations, the research, the practice, all of the innovation and outreach, all of the things that are necessary for you to be successful in your daily work. Daily, we work closely with the administrator of the program, and the administration of the program rests in ONDCP. Helen Hernandez is now the wonderful administrator, and we have a great working relationship with her. We, in fact, meet or try to meet on about a monthly basis with all of the partners to talk about this program and to make sure that we're doing what is important and what is very, very helpful. Our friends at SAMHSA, primarily in the Center for Substance Abuse Prevention, and their grant management office then manages these grants that you all are either have or aspiring to have or have had, and they do that in a wonderful manner. The program is now led at SAMHSA by Mr. Charles Reynolds, who is the Director of the Division of Community Programs. He's ably assisted by Costello Green. You all probably have seen Costello and Alan Ward and many others. And so, yeah, do that. Applaud them, please. And all of the wonderful project officers that are here, they have an office downstairs. If you haven't had a chance to stop in to say hi to them or see them, please feel free to go do that. That makes the team that is so critical for the work that we do, and we are very, very happy about that great team. Now, internally, the woman who is extraordinarily efficient and professional and that leads the Institute is Karima Abdullah. Karima, please stand, will you? Karima made the mistake of running a coalition in Atlanta, Georgia, called the Genesis Coalition. I knew that, Genesis Coalition. The mistake that she made was back in 1998, that coalition became CADCA's Coalition of the Year. And I was looking to bring some people onto my Coalition Advisory Committee to help me manage CADCA. And I went to Atlanta and recruited her, and she became one of the original members of our Coalition Advisory Committee. And because she did such great work there, I then got in trouble with the city of Atlanta because I recruited her to become a permanent part of our staff, and that was nearly 10 years ago, and we are very excited about her being the leader of this institute. Now, she has some wonderful people helping her. I don't know whether Carlton Hall is in the room or not. Carlton, are you in the room? If not, Carlton is the deputy for training and TA, been with us for a long period of time. One of our new deputies is Dr. Bill Gary. Bill is the deputy for evaluation and research. And currently we have leading our area for innovation and outreach is Christy Miller. Christy, where are you? Christy is in here, I know that. Thank you, thank you. So we have a great team, and we're very happy about them. So we are all about community problem solving, and that's been what we have been doing. You know that all of our work has been, we get an annual evaluation every year from Michigan State University. That information is available online. They have said that if coalitions implement our training with fidelity after going through CADCA training, that you're more apt to be implementing the appropriate environmental strategies that are going to lead to reductions in all areas of substance abuse in your work. I think you know. If not, you should check it and use it at the local level because it's important for you to do that the training that you go through has been codified and published in the Journal of Community Psychology. So you can use that in your work when you're asking for support and dollars. And that happened in August of 2012. And the National Youth Leadership Initiative was just this spring published in the Journal of Community Psychology as being an effective youth development model. So I want you to take advantage of that and use that. But that's what we have been all about. Our NYLI, if you haven't had a chance to stick your head in and look at the nearly 500 young people that are here, spending a week of their time to learn the strategic prevention framework that is taught by young people, please do so. We have 2 courses going on. One about 50 is the core essentials, and then the basic course of nearly 400 are in that as well. We've gone. We are attempting to go high-tech. I almost say we've gone high-tech. We are attempting to go high-tech with online courses. We've had Kirby Kreider here to demonstrate those to you all week, and 2 that are going on that we are releasing this week is the Coalition Core Essentials course and the course that NIDA helped us put together on the science of marijuana and its impact. We already have online a prescription drug abuse course that you can take, and all of these are free, and I want you to take advantage of those, and please do that. But before I introduce the speaker, I need to ask one more thing of you, and that is that you might know that this year, because the president's budget was restricted, they were not able to recommend the dollars that we wanted for the Drug-Free Communities program. We went to Congress, to both the House and the Senate, with your data, and we were able to convince them, as Sue said earlier this week, in case you missed it. In the House, we were pleasantly surprised with Chairman Rogers' support to get the House to mark it at $95 million, which is $3 million higher than we've ever been. And the Senate marked it where we are currently at $92 million. Now, the director's going to shoot me for taking all of his information, but I hope he doesn't mind. But the point is this, that I have a public policy team. You know who leads that, Sue Thaw and her great team back at CADCA. We reach out to you to get the information and what you're doing through legislative alerts and other kinds of areas. And with that information, we can convince very specific selected members of Congress to continue to fund and support this program. I don't know of any other programs that are growing the way we are growing in this very resource-restricted environment. But it's a team effort. My experts in Washington cannot do it alone. You are a critical link of that. And I wanted to end by reminding you the important role that you play. Please let us help you so that we can continue to be successful with this program. It is so critical that we do that. Now I want to introduce a good friend, Michael Bonicelli. You know, I'm going to say he's the acting director so that I can be politically correct, and after that I'm going to call him the director because that's really what he is. So I've done the political correct thing by using the word acting once, so now I can call him director of the Office of National Drug Control Policy. For those of you that don't know, he started that he came to the office in November of 2012 as the deputy director. And this summer, when Mr. Gil Kolakowski moved over to the Customs and Border Control, and we also say, God bless you, Gil, because you've been reading about him in the paper and all of the issues that he's facing, so we say, God bless you, Gil, in your work. Michael became the director of Office of National Drug Control Policy. Before that, he was in the great state of Massachusetts, where he was the director of the Bureau of Substance Abuse Services, and that was a part of the Massachusetts Department of Public Health, where he did yeoman's work. He was a role model, a professional that understood the needs and the requirements for people who were suffering with substance abuse disorders. And he led his department to make sure that those people got the services that they needed. But he also did other things in Washington. The National Association of State Directors, he served in that organization in a leadership capacity. He was an advisor on the Center for Substance Abuse Prevention Advisory Committee. He worked with the Alliance for Suicide Prevention, so he did just yeoman's work over the last 3 years. Now finds himself in a great position to continue to forge and put together the kinds of policies that's going to help us through these very treacherous waters that we find ourselves in. So I can think of no better qualified, passionate professional to lead our effort than Michael Bonicelli. So now, before he comes up, I got to do one other thing. Now, you guys all got here, and you went to registration, and you picked up one of these. What happened to my bag? Somebody took my bag? And you all got one of these when you registered, right? When you all registered, did you all get a bag? Well, if you are, we don't use the word VIP around here, but if you're one of those people, you don't go through registration. You just kind of show up. And he didn't have a bag. And it came back to me that Michael was complaining that General Dean didn't give him a bag. And that he would have to go back to Washington without one of those beautiful bags. So I'm going to take the time as he comes up to give him his own personal bag. Come on up here. I'll make sure you get it.
Okay,
I'll hold it for you.
So he's actually entirely right. That I was in a meeting with some of the coalitions, and I noticed they had these great cooler bags. You know, and being Italian, I'm always carrying around food. You know, that's like God to me. So I'm like, these are the coolest bags. And this is also a testament to how good his staff is. That in probably about 2 minutes, it got back to him that I was coveting the bags. But seriously, you know, I really want to thank General Dean and his entire staff for the work that they do. And, you know, he talked about the importance of the work that you do and the importance of us showing up to acknowledge it. And I hope in some small way my being here is really a testament to how our office and how our administration values the work that you do on a daily basis. You know, I've spent the day here at meetings, and people often will come up to me and say, "Oh, isn't it exhausting?" And actually, nothing but the opposite could be true. To really hear from all of you around the work that you're doing really inspires me and inspires our staff to go back, to make sure that we're doing good things, to make sure that the work that we're doing really supports all of your local efforts. And, you know, General Dean is correct, and I want to thank Sue and Karima and all of the staff because, you know, one of the easy jobs that I have is talking to Congress about DFC programs. And I cannot tell you how valuable that work is and how people understand the value of those community efforts. So I really want to you know, extend on the behalf of the administration the important role that you play. We are all clearly here for a common goal to really create healthy and bright futures for all of our community members. And as General Dean talked about, now more than ever, it's really essential that we work together to address the challenges facing the communities that we serve. And while we're really thrilled in terms of the additional dollars, we know that we will always have limited resources, so making sure that we're working effectively together. I think you know that the President's annual National Drug Control Strategy serves as a blueprint to address the challenges posed by drug use and its consequences in the United States. Just 2 weeks ago, the administration unveiled its 5th strategy, but the first one since I've become acting director. And you can find a copy of that fact sheet. And I will talk a little bit about our drug policy reform plan. But for those of you who don't know, let me share a little bit about my personal story. I think many of you know I'm a person in long-term recovery for substance use disorders. And I don't say this to be self-congratulatory. I'm speaking about my recovery because for too long, the stigma associated with the disease of addiction has quieted too many of our fellow Americans struggling with this disease. I am one of 23 million Americans in recovery. And I can't overstate the importance of this administration's efforts to reform drug policy in a way that finally recognizes that substance use is a public health issue, not a criminal justice issue. And I know, isn't that amazing? You know, and I do, you know, I actually want to stop and really give a shout out to former Director Kurlikowski. And I remember when I was in Massachusetts at the time, and the administration unveiled its first strategy, and then Director Kurlikowski, a former police chief, talked about the fact that we can't arrest our way out of the problem. And I couldn't help but be amazed in terms of the shift in policy. And much of that has come from the work that you all have done to proving that we have can have a different response. We know that law enforcement will always play a vital role in protecting our communities from drug-related violence and harm, but again, we know that we can't arrest and incarcerate a way out of our drug problem. I continue to be impressed by the role that DFC coalitions play in convening all community stakeholders, but particularly our law enforcement work. And when I sit in these meetings and I hear our law enforcement folks supporting prevention efforts, talking about our community response, and our prevention folks supporting law enforcement efforts, I know that the work that you do is having an effect. The damage caused by drug use and substance use disorders projects far beyond those individuals that have tragically lost to overdose. Drug use tears families apart and drives crime. It hinders academic performance among young people. It strains our already overburdened criminal justice and public health system and places obstacles in the way of prosperity by harming our economy. The truth is, I have not yet met a family in the United States who has not been affected by substance use disorders. They are our family, our coworkers, our neighbors, our friends. All of us know someone who's been touched by the consequence of substance use. Perhaps they are struggling to recover from a substance use disorder, victims of drug-related crime, or hoping for a second chance despite a previous criminal record. This is why we have a shared responsibility to reduce drug use. Doing so will not only make our nation healthier and safer, it will ensure that our nation is prepared to meet the challenges of the 21st century. As a person in recovery, I couldn't help but think today, what if my community had a drug-free coalition? What if I was a member of a coalition? What if I was a member of Karima's Leadership Institute? Would my trajectory have changed? And I can't help but think that it would have been. So it just says to me, we can make change. Our approach to this challenge should be guided by what experience, compassion, and most importantly, science tells us about the true nature of substance use disorders in America. That is the approach set forth in the strategy, which outlines more than 100 action items that are the building blocks of drug policy reform. Central to this strategy is the administration's forward-looking drug policy is the understanding that substance use disorders are a disease that can be prevented, treated, and from which one can recover. Now, no secret to anyone in this room, the strategy begins with an emphasis, as it should, on prevention. We all know that preventing drug use before it begins, particularly among youth, is the most cost-effective way to reduce drug use and its consequences. Prevention, in fact, is at the heart of all you do to strengthen your communities. That is why the strategy lays out actions for expanding national and community-based programs, specifically our drug-free community support program, that works to reduce substance use in schools, on our campuses, and in the workplace. We are tremendously encouraged by the DFC national evaluation that shows the positive impact and effectiveness that your work is happening on a local level. Our data continues to demonstrate the program's impact in preventing youth substance use. The DFC program continues to validate the effectiveness of coalitions, bringing together schools, businesses, law enforcement, parent groups, and other members of the community. The program acts as a catalyst that helps bring communities together to protect youth from substance use. This important work cannot be done by one individual or one group alone. Each sector of a community, the core of the DFC program, has a role to play when it comes to preventing youth substance use. In further recognition of the power of prevention, the strategy calls on the medical community to expand programs like screening, brief intervention, and referral to treatment, and I'm saying that to my friend in Northampton. That empowers healthcare professionals, there he is, to intervene early at the first signs of trouble. Early detection and treatment of a substance use problem is more humane and less costly than dealing with the consequences of addiction, including crime and incarceration later on. This strategy supports efforts to make access to treatment a reality for millions of Americans. We know that treatment works. And now the Affordable Care Act, for the first time in history, requires insurance companies to cover treatment for substance use disorders just as they would cover conditions, any other chronic condition like diabetes or hypertension. But I know, isn't that wild? By expanding insurance coverage, this new law, the most significant piece of drug policy reform in generations, will expand access to addiction treatment for millions of Americans who need it, and not just those who can afford it. This strategy also gives a voice to people in recovery from substance use disorders and outlines steps to help lift the stigma often associated with disease. Today, there are millions of Americans in recovery who are healthy, responsible, engaged members of the community. The strategy works to reform the laws and regulations that impede recovery, including those that place obstacles in the way of housing, employment, obtaining a driver's license or a student loan because of a prior conviction for a drug-related offense. The strategy also supports smart on-crime approaches to drug enforcement, such as drug courts. Today, more than 2,700 drug courts across the country are diverting hundreds of thousands of nonviolent drug offenders every year into treatment instead of prison. The strategy also addresses some of the most urgent and immediate challenges that we face today, particularly the abuse of opioids, a class of drugs that include prescription painkillers and heroin. With reports of increasing heroin use in many communities across America, we are growing increasingly concerned by the potential transition from prescription opioid abuse to heroin and injection drug use. And I was really heartened to hear many of our community coalitions helping our work around opioid abuse reduction, as well as overdose prevention, and I really applaud your work. The strategy pursues a comprehensive approach to addressing this rising threat. We have intensified our focus on overdose prevention and intervention, and therefore are working to increase the use of FDA-approved medications to treat opioid use disorders, including treatment within the criminal justice system. We are also working with the Office of National AIDS Policy, federal partners, and state and local governments to develop a collaborative approach to address substance use disorders, as well as the public health issues that result from increased use of syringes, including hepatitis and HIV. In addition, we are working with law enforcement partners across this country and around the world to disrupt and dismantle criminal organizations involved in drug trafficking and heroin trafficking. My pages are sticking together. Through these partnerships, we continue to seek to improve ways that we can improve our data collection on heroin use, production, trafficking, and street-level sales. You have probably heard of the administration's vision of an America built to last, where an educated, skilled workforce has the knowledge, energy, and expertise to compete in the global marketplace. As DFC-funded community coalitions, you help us move closer to that vision by protecting youth from substance use, and most importantly, by bringing them to the coalition table as key partners and leaders. I am sure that you can feel the power of the movement, from the nearly 400 young people here this week to participate in CADCA's National Youth Leadership Initiative. This initiative equips youth with the knowledge and skills to create meaningful community-level change. I can't help but acknowledge, as General Dean talked about the history of CADCA, that we're having a town hall meeting, which actually originated in New England, right? Originated in New England. I wanted to say Massachusetts, but I was unclear of my facts. But we have historically used town hall meetings to make change in our community and in our nation. And it's only fitting that when General Dean talked about the power of CADCA and the history of CADCA, that we not reflect on the meaning of town hall meetings and the power of town hall meetings to change work at the local and national level. President Obama had a quote that I continue to use. And he said, "One voice can change a room. And if one voice can change a room, it can change a city. And if one voice can change a city, it can change a state. And if one voice can change a state, it can change a nation." So I encourage you to continue to be that voice. We need that voice. We need more than one voice. So continue to do the good work that you're doing. I'm also thrilled today to announce that ONDCP will be expanding support of CADCA's National Youth Leadership Institute. Thank you. And it's only because General Dean and Sue do such a good job at making sure that Congress gives us the money to be able to do it. But it's important that we use this money in this way because we recognize the critical role that young people play in your coalitions. And this increased funding is designed to further engage our young people from special populations such as LGBT youth, military family youth, African American and Hispanic youth, and youth living in urban areas of our country. Let me close by explaining why I'm so pleased to be with you here today. The National Drug Control Strategy is your strategy. It reflects your input, your experiences at the local level, not only by helping us identify problems and craft solutions, but also recognizing that substance use disorders are a major national public health concern, not just a criminal justice issue. You are truly local heroes working to strengthen your communities and protect our nation's greatest resource, our young people. Without you, our strategy is only words on paper. You bring it to life. For that, you have my personal admiration and my deep appreciation. On behalf of the entire Office of National Drug Control Policy team, Helen, Victoria, Andrew, and our partners at SAMHSA, and particularly our partners at CADCA, thank you for your commitment to strengthen communities and to keep young people safe, healthy, and drug-free. Thank you very much.
I really think you already knew that he was the right man in the right job at the right time, but you can tell the passion that he has. So thank you so much. Thank you so much. Now I'd like to bring up the administrator of our program, Helen Hernandez. Has been doing this for a year now, been doing it exceedingly well, and I'd like to bring up and have her make some remarks for you. Now, the administrator of our drug-free program, Helen Hernandez. Helen, come on up.
Good evening. Good evening. Thank you. That's so much better. Again, thank you all for being here. I know especially after 3 full days of intense training from CADCA that you are all exhausted. I'm Helen Hernandez, and I'm the administrator of the Drug-Free Community Support Program, and I have to tell you, I am absolutely impressed by the number of you that are here today. I'm impressed because of your commitment to the field of prevention. Whether you are currently a DFC-funded community coalition or a coalition that is interested in becoming a part of the DFC family, thank you for the work that you do. I don't think you hear that enough. As the director mentioned, prevention and the DFC program continue to be the emphasis of the National Drug Control Strategy. And he said it best. This is your strategy. As you read that strategy, as you read the fact sheet that you have in your packets today, you should see the work that you do. So I want to begin by thanking General Dean and all of the CADCA staff for organizing this powerful movement and for hosting this town hall. We don't often have, the director and I don't often have the opportunity to meet with so many coalitions from all over the country in one place. So thank you, General Dean and CADCA staff for organizing and hosting this town hall. Much like we ask our DFC community coalitions to collaborate and reach out across the table to other sectors of their communities, you should know that we do the same. CADCA, SAMHSA, and ONDCP meet regularly, and I actually said this during my applicant workshop. We meet monthly to discuss the program, to discuss what we are seeing across the country. So I want to acknowledge, and General Dean already did this, he acknowledged the SAMHSA staff under the leadership of Charles Reynolds and his branch chief, Costella Green and Alan Ward. But I also want to thank the project officers. It is the SAMHSA project officers who work tirelessly directly with those community coalitions every day to provide them with the training, guidance, and support that they need. So I'd like to ask the project officers in the room to please stand. I also want to acknowledge someone who's not a project officer, but still quite the important lady. I want to acknowledge Miss Virginia Simmons. She is the Grants Management Officer. She is the person you want to go to when you have a DFC grant and have fiscal questions, budgetary questions. That is the gal you want to go see. So please make sure, as General Deed mentioned, the SAMHSA staff is on site. Please go by, say hello. Like I said, they work tirelessly and they don't look quite tired yet. So please make sure that tomorrow you get a chance to go visit them. They're located downstairs. Now, before I move forward and provide you with some updates, I think you might be interested in hearing about FY14 funding, maybe? So before I go there, on your tables, you will have a card, and that is a card for question. We want to have an opportunity to ask the director of ONDCP for your questions. We want to make sure that we have an open communication. So how this will work. Please write down a question, and I don't know if you've met Victoria Comiskey and Andrew Hertzberg. You've heard their names, and they are absolutely wonderful staff. So Andrew Hertzberg is right here. They will be, and where's Victoria Comiskey? Oh, back there. That is actually your DFC team at the Office of National Drug Control Policy. So they will be running around taking questions that you write down, and we will collect them, throw them into this huge silver bowl that we have been provided, and randomly pull out a card. And so the way this will work is I will pull out randomly a question. I will call out your name, and you will come up to the mic and have the opportunity to ask the director a question. And who knows, there may or may not be a White House memento for you if your question gets pulled. So make sure you get those questions in, lift them up. Victoria and Andrew will be running around. Somehow the White House memento thing gets those hands up quick. So I know we're all interested in hearing about FY 2014 funding, and that's absolutely wonderful. I know it's going to be a little bit tough, but I'm going to ask you to hang in there for a few more weeks. SAMHSA staff just notified my office of scores from the peer review process. And so as soon as we get back to the office on Monday, we will be looking at that list and making funding decisions. As you know, the process is we get a ranking, highest scoring DFCs to the lowest, and we really fund till we run out of grant dollars. So we'll be doing that, and as you know, the program is very competitive. It continues to be competitive because of the skills and training that you receive from CADCA and your project officers. You are doing great work. And so for 14, if you wanted to know how competitive the process was, we received 427 DFC applications. And only 10 were deemed ineligible because of statutory eligibility requirements. That is the lowest it has been in DFC history. And I have to thank the SAMHSA staff and ONDCP staff, Victoria and Andrew, for their assistance in revising the request for application. I said this last year at the mid-year. I said it this morning during the workshop. It is my goal to make these requests for applications easier. I want you to succeed. I want you to be able to submit an application. So from those 10 that were deemed ineligible, we ended up with 412 applications that went to peer review. And I got asked this question today: what was the ratio of applications that came in from years 5, for year 1s and year 6? So we received 260 year 1 applications, and we received 152 applications for year 6. In addition to that, we received 22 DFC mentoring grants. 19 of which went to peer review. So this is the best demographic or facts that the data that we have to show that we are making changes to these requests for applications that are really making a difference in the applicants that we receive. So we are very proud of that. More great news is that for FY 2014, we will have a very large DFC class, and we are so excited about this. We have over $22 million for the DFC support program. That'll allow us to fund approximately 182 new community coalitions. So I ask that you hang in there just a few more weeks. We anticipate that we will be able to make award announcements the first or second week of September, and I promise you that as soon as we can, we will announce awards. General Dean gave you an idea of what the DFC budget is looking like in the Senate and the House. We are very excited about that, and again, that would not be possible without the success of our DFC coalitions. So that's the idea for FY15. We will anticipate funding, and hopefully it stays in the positive and on the plus side. I also want to take this opportunity to remind you that October is National Substance Abuse Prevention Month. And in an effort to continue this powerful movement that we've had this week here in Orlando and that we had at the CADCA Forum, I want to encourage you to contact our office. I have provided every single one of you my phone number and my email. It's in the packets. You also have Victoria's contact information and Andrew's. We want to talk to you. We want to hear your stories. Let us know what you're doing, what events you might have planned for October, and let us know how successful your Prevention Month plans are. In an effort to increase communication, to increase the power of this movement, we need to hear from you. We also want to continue not only this power of the movement, but we want to continue to highlight and encourage for collaboration and successful story sharing between coalitions. So if you have an event, a success story that you want to share with us, we absolutely want to hear about it. Not only that, but every once in a while, the director and I get to escape the office and visit a few locations. So keep us informed, let us know what you're up to. We might show up. So we recognize that going back to your community and explaining what a DFC community is, what it is you do, and why it matters can be a bit challenging. But we want you to know that we all know that the premise is simple. DFC is about communities coming together to create change, community-level change, and about protecting our young people. And the good news is that we all know it works, thanks to your data. So to help you with these conversations and making these conversations easier for you in your communities, we have actually developed a tool to help you. We have provided you a tool for that elevator speech that we often talk about. We've created a DFC infographic, and I think you all have them at your tables. This illustrates what we do. This illustrates the heart of the DFC program. It's about community sectors. It's about bringing everyone on board to work for a specific purpose. It illustrates what you do, why it matters, and the fact that this program works. The director and I not only enjoy hearing about what you do, but every once in a while, like I said, we get to go out. So please feel free to reach out to our office. We want to hear from you. No one answers the phone for me. I answer it. So if you give me a call, I will pick up, and please don't be surprised by that. I look forward to hearing from you. And again, on behalf of myself, Victoria, of Andrew, and the rest of the ONDCP team, thank you for all that you do every day in your communities. Now, let's move on to some questions and answers with the director. Come on up, Director Botticelli. So like I said, there may be a White House memento involved in this. So what we're going to do is Andrew's going to pass the bowl. Going to pick up a question, and I'm going to call the person who submitted the question and have them come up to the mic. So can we please hear from Derek Franklin?
Well, thank you, Mr., to be politically correct, Acting Director. Thank you for your support. Thanks for all you do. My question, I was thinking about this, is a little tough. I'm from Washington State.
I saw it, and I knew what the question was going to be.
I sort of chuckled, but and you may anticipate this question, but a question I've got is that, as you know, we have legal marijuana in Washington State, and we've been told that there are 8 enforcement guidelines from the DOJ that our state's following, and I had the opportunity today to talk to some friends about that, and feel strongly that in our case, it's no longer an experiment, really, about whether or not those are being followed in Washington, but really that they're not being followed. That the rule is that they're not, and many of us in the state are wondering if there's new information, ideas, or direction that you might be able to provide as we think about where to go with that.
Sure,
Thank
it's a really important question. So first of all, let me say this. Just before we started this meeting, I had the opportunity to sit down with many folks who were doing community coalition work in Washington and Colorado. And, both my thanks and my heart goes out to them. And it was really hard not to be moved by the courage that I really felt with many of the people in Colorado and Washington who are doing this work despite some really adverse things working against them, and going to town council meetings and being called a liar when you're presenting science. And I really want to thank you for having the courage to tell your truth. And to speak from your heart and to speak from science. This is never easy work in the best of circumstances, and I know that you have some particular challenges. To your question though specifically, let me talk about what our office is doing. One of the things that's important for us is to really monitor, look at those 8 DOJ criteria that are both public health and public safety criteria. We've convened and had a number of meetings already across our federal partners to really look at and identify any federal, state, and local data that we have that crosswalks to those 8 criteria. So the important piece for us, too, when we were talking about this with the coalitions, is that you provide us the information that we want to make sure that we understand what's happening at the local level as it relates to those criteria. Again, I think there's been lots of anecdotal reports that really raise our eyebrows and I think have us cause for concern, but we really want to make sure that we're using the best available information that we have to really understand what's happening on the ground in Colorado and Washington. I think even despite having these data, that we'll have some challenges in people actually believing the data, but I think it's really important for us, and we take it as a responsibility of ONDCP to make sure that we are at least trying to tell the story about, from a scientific and a data-driven standpoint, what happens and what is happening in Colorado and Washington and as we move forward. So Helen put out an offer to our coalitions, and we'll continue to extend that, to the extent that you have data that you're able to show. So not, we're trying to be scientific here. So not just stories, but the extent that we have good data in terms of what the impact is, clearly our office wants to know about it.
Thank you so much. And if there's anything that we can do with the comment data that we submit, looking at Washington, looking at Colorado, anything we can do in our state to adapt that or clarify through that process, anything that would be helpful to your office, I hope you'll tell us.
Great.
Yeah, thank you so much.
Absolutely.
Massachusetts.
I did not.
So the next question, I feel like this is bingo. The next question is going to come from Paul McNeil.
So if you've never been to Northampton, Massachusetts, I know that we have many, many pretty places around this country, but Northampton, Massachusetts is one of the prettiest places.
Thank you. He's already kissing up. You know what I'm going to ask about? No, I'm going to.
How do you think I got this job, Paul? No, I'm only kidding. Only kidding.
Paradise City. It's a beautiful, beautiful place. Come visit us in Western Mass. My question is around opioid use and prescription drug use in education. We have these wonderful curriculums that we use across the country for middle schoolers and high schoolers around alcohol, tobacco, other drugs, and they're really comprehensive, and we've been found effective about increasing perception of harm, decreasing risk factors, and it's been great. Opioids are sort of on our radar way more than they ever have been, and I wonder if there's any movement at the national level to sort of bolster or reassess our youth education curriculums around opioids and prescription drugs specifically, to incorporate those and sort of raise people's awareness.
This is a really, really good question, and we'll actually get you the material. NIDA actually put out a report that looked at existing evidence-based prevention programs and looked at those that were effective in reducing prescription opioid misuse. So if you haven't seen that, we'll make sure that you get this. So these are existing prevention programs and existing prevention curricula that we have now that have been shown effective in reducing prescription drug use issues. But you know, while we're on this topic, you know, one of the things that, you know, we've been talking about in Washington and but also even within our coalition meetings, there has been a significant amount of attention raised, and rightly so, around the prescription opioid misuse issue and the overdose issue. But you know, one of the things that I think we all have the opportunity to do, and I try to do this at the federal level whenever I testify in Congress or whenever I do issues, is that to really talk about, one, the effectiveness of our prevention programs, and two, really help people to understand that, you know, that addiction to opioids starts at a very young age, often with alcohol, tobacco, and other drugs, right? So, no, it's true. And I mean, you know, and I think, you know, part of what we want to do is to show folks, one, that, you know, addiction often has its roots in youth substance use issues. So how do we use the momentum? You know, how might you capitalize the momentum that's happening at the state, local? We're trying to think about on the federal level. Sue knows this, in terms of lots of momentum right now in Congress to kind of deal with this issue. So how do we continue to put forth, you know, good, effective programming, including prevention programming, to deal with this issue? So, you know, so let's try to kind of think about how we can collectively capitalize on some of the attention that we're seeing across the country around prescription drugs and heroin misuse issue and the overdose issue, to really enhance the entirety of our continuum of care, from prevention through recovery support services.
This next question is from Arizona. The question comes from Doug Herbert. Doug, there he is.
Thank you, Director, for attending this conference and giving me the opportunity to speak. I'm a retired DEA agent and a member of the Fountain Hills, Arizona Coalition. One of the things that when I was with DEA that Administrator Lenhart had done is, when we saw the issue with the prescription drug abuse problem, the threat in the U.S., she took elements of the regulatory side of DEA and the enforcement side and brought it together as a force multiplier to address the problem. And with ONDCP, we have the DFC program and we have the HIDA program. And it'd be nice to see if the DFC could have representatives on the HIDA board to have some influence, as well as maybe directing some of that HIDA funding to go into those coalitions as well.
Great. So thank you for those comments. And it was very interesting today, because actually one of the meetings that we had was with the Central Florida HIDA and with our DFC coalitions. And part of it was, I do think it's a really good, and we've really been trying to encourage, you know, both with our HIDA programs and our DFC programs, to really have, you know, that force multiplier, is an expression that I just learned, now kind of doing all the, you know, supply reduction stuff. But it really is, and I think what ends up happening is that you get a really good kind of whole of community-based efforts. I think, you know, for a long time, our DFC coalitions have done a remarkable job at engaging law enforcement. And we do see that there's opportunity to make sure that we are connecting our HIDA programs and our DFC programs, which is great. You know, I wouldn't go so far as to say, you know, and part of it too is, many of our HIDA programs are actually doing prevention and demand reduction work under their HIDA programs, right? So part of our work is not necessarily directing each of our HIDAs in terms of how to spend that money, but we do like them to see doing some level of prevention and demand reduction. So many of our HIDAs are supporting that work. You know, so for example, we heard today, you know, a portion of the HIDA money in Central Florida doesn't go to the DFC coalitions, but they're helping to sponsor prevention in concert with the DFC coalitions, sponsoring prevention conferences. So a lot of that work is happening. We'll continue to make sure that we broker through contractual relationships and through just our bully pulpit to make sure that we're having good energy between our HIDA programs and our DFC programs.
Thank you.
This next question is from Ohio, from Kenton Beachy. Kenton, are you here? There you go.
Thank you for taking my question. It has to do with the DEA proposed regulations for drug disposal. In Ohio, our coalition is pioneering making drug disposal boxes more customer-friendly in more friendly places in consultation with law enforcement. As a result of our advocacy, our State Board of Pharmacy has adopted new rules allowing placement of boxes in pharmacies,
Wow, that's great.
among other places.
Good job.
But they're only willing to do that at the point that the DEA regulations are finalized. So there are three parts to my question. The first is, what can you tell us about where that proposal or finalization process is stuck right now? And just as a side comment, this is a result of an act that was passed in 2010. So 4 years down the road, our message is, what's going on over there? We're dying out here. The second part of the question is, what can you do to help expedite that process? And then the third part is, what can we do to help expedite the DEA in accomplishing that?
Good. No, it's a really important question. Thanks. I appreciate your questions. You know, and again, you know, it's really been amazing to see our coalition work around the support for the drug disposal programs, and you know, going over some of the preliminary data. You know, I was really astounded by the number of programs that are doing it. So I have to be careful here in terms of how I talk about this, because it's a regulatory process that's in play. So one is that we know that this is a tremendously important rule for all of you. We've been working very closely with the DEA. The DEA, you know, there's a process. They received over 200 comments, I believe, in terms of the interim final rule, and are processing that. I actually just had lunch with Administrator Lenhart the other day, who assured me that they are moving as quickly as possible to get this rule out, and they hope to have it out soon. So.
This next question is from Linda Sirks from New Jersey.
Thank you so much. I run a coalition in New Jersey. I've been in substance abuse prevention for over 20 years. I also lost my son to a prescription drug overdose 10 years ago, and I've been working very diligently to address those issues. So one of the things that we find is I think is really important is the prescription monitoring program. And I'd like to know what the feasibility is of instituting a national program so that all of the states can be talking to each other, and thereby doctors are really getting more aware of the problem and attacking it at the very beginning.
Great. Thank you for that question. And thank you for sharing your experience and turning that pain into advocacy. I think it's really remarkable and courageous in terms of doing that. I think you know, if you've taken a look, in 2011, our office released a prescription drug abuse prevention plan, and one of the main pillars of that plan was on monitoring and calling for good, usable prescription drug monitoring programs. You know, we've made significant progress since then. In 2006, I think we had 20 prescription drug monitoring programs, and now we have 49 programs, 48 are operational. Who's here from Missouri? That's good. There was actually a very good story at the front page of the New York Times last week about Missouri being the lone holdout. Let me tell you, I think, you know, this suggestion has kind of come up a number of times, and kind of why can't we have one program, one standard? And I think folks, as they have looked at that, the expense and feasibility of doing a national program by far outstrips kind of the local efforts to be able to do that. These are locally controlled programs in terms of that, and that does present challenges. But one of the things that's been important, to your point, is movement toward making sure that we have good, what we call interoperable programs, right? So that a program in Kentucky shares information with a program in Georgia, so that as one state implements that, you know, people aren't just moving to another state to do that. And I think we now have, I think, 20 states, if I remember correctly, that are able to share that information across programs. So we really want to make sure that, again, I think we have the same goal. And we also work with the Brandeis Center of Excellence on prescription drug monitoring programs to make sure that all of the programs that we have are adhering to some of the best practice standards that we have. So it's a good question. We get it a lot. But I think when you look at the utility and the expense of having a national program, I worry sometimes about what would happen if we had a national program. You know, I think you know some of the discussion and volatility of these programs, even at the state level, has been challenging. But I think that we all understand the value of those. If folks haven't seen it, it's really good information that just came out from the Centers for Disease Control that looked at prescribing patterns by state, right? And so it can be really good information because there's a tremendous amount of variability in the number of prescriptions that are given out by state. Florida is actually a really good example of a success story. So Florida had by far one of the most significant prescription drug abuse issues and overdose issues in the country. I think 98 out of the top 100 prescribers for prescription medication were in Florida, and the vast majority of them, I think, were in Broward County. And Florida, through a series of advocacy and change, implemented a prescription drug monitoring program. We worked with HIDA and local law enforcement and the DEA and others to close down the pill mills. And since then, Florida has seen a significant reduction, if I remember correctly, a 28% reduction in fatal overdoses as a result of those actions. So we know the value of prescription drug monitoring programs in reducing the risk.
This is going to be our last question, and it's coming from George Hawes from Nebraska.
Would you please just wrap up by sharing with us specifically one reason that you have to be optimistic about the future?
So, what a fitting way to end this discussion. And I also can't help but notice that you're from the tobacco-free Lincoln County, right? So why should I be optimistic? And by example, look what this country has done around tobacco and tobacco use. Look at how we have changed the conversation. We've changed community norms. that we've involved youth in that. So I am optimistic. And as General Dean talked about, so how many people were in this room 10 years ago? 300. And how many youth started with the Leadership Institute? A handful. So I do feel optimistic. I don't think any of us would be doing this work if we weren't optimistic. But we have the power to change things. We are not powerless in this work. We know what works. And what's really helpful is when you're on the right side of things. You know, one of the, let me tell you this too, and the other reason I have to be optimistic, Helen and I were talking about this today, and this, you know, one of the things that, at least for me, I've kind of heard today is, you know, you go to meetings and you spend the day and certain themes emerge. And one of the themes that I heard, that Helen heard and other folks, is the story of prevention, right? And so if you sat in that mock Orlando City Council meeting, if you sat with the youth, if you sat with the people who are doing this work, that's what makes me optimistic, because we have incredibly passionate, committed people who are on the right side of this work, doing this work. And you know, sometimes I feel like, and I don't know if you feel the same way, that because I've been doing this work for a long time, that I have a skewed perception of things, but I think things are changing. I think when you look at things like the Affordable Care Act, when you look at things of what's happening around criminal justice reform in the United States, when you look at what's happening in terms of people understanding the issues around substance use, I think we need to be optimistic. So you know, I do not want us to be deterred, and I don't want to be deterred by marijuana derailing the conversation. That our work is too important. And I'm not saying that I don't think we need to take it head on. I'm just saying we cannot be discouraged by this. You know, because we know prevention is a long haul effort, right? And so it's not about, you know, yes, it's about what we do today, and I heard this from many of our coalitions, but it's about the legacy that we leave behind. You know, and I'm really optimistic. I've said this many, many, many times, that part of what I get out of doing this work is I have never met a bunch of more compassionate, committed people doing this work than the people who are in this room right now. And if we hold together, if we work together strategically, we can make change, and we can see that change. We have the power to do it. So, so what else do we need? You know, what else do we need in this battle? And part of it is, you know, we need to tell our stories clearly and convincingly. We need to continue to involve our youth and empower them to be all that they can be. So, you know, I know that's not more than one reason, but I am optimistic, and I know all of you are optimistic, and, you know, we need to continue to carry that. And that doesn't mean that we don't get discouraged from time to time, but we need to support each other in this work. You know, look at the leadership that you're getting here from CADCA and other folks. You know, we do have reason to be optimistic. So, you know, please carry that energy back to your community. You know, you keep us inspired. I hope we can continue to keep you inspired by doing this work. So thank you very much, everybody.
Okay, we have one more full day tomorrow. I know you will be excited about that. Thank you for giving us your time this evening. There's still some sunlight out there. Enjoy your rest of your evening. We'll see you tomorrow. And those of you that are going to be in the tobacco events, the event on Friday, we'll see you there as well. Thank you very much. And thank you to Helen and the director for this wonderful town hall meeting. Thank you. Have a good evening.